Good afternoon, good evening to all of those that are with us from different countries of the Americas and other continents. We would like to warmly welcome you, and we hope that the information provided at this seminar is useful to prevent African swine fever. My name is Erika Calderon. I work for the Inter-American Institute for Cooperation on Agriculture, IICA, and today I will be with you acting as moderator of this event. The event counts on simultaneous interpretation in 4 different languages: Spanish, Portuguese, French, and English. We would like to invite you to tell us what country you are accompanying us from. We would like to remind you that the organization of these seminars is a joint effort of several national as well as international organizations that work in favor of animal health and food safety and other agricultural matters of interest to the hemisphere. We will start by officially opening the event today with some opening remarks by our Director of Animal Health and Food Safety, Ana Marisa Cordero, who will start with the opening remarks. The floor is yours, Ana Marisa. Hello. Hello, thank you, Erica. Special greetings to all of those that are with us today. Welcome to this second seminar of 2022 on emergency actions in face of the confirmation of African swine fever. Very special greetings also for Katya Martinez and Andres Gonzalez that will be joining us with some opening remarks also today. And a very special appreciation to all our speakers today who have taken their time out to join us today to basically share experiences that will help us hopefully to implement best practices, to learn about some specific actions that could be implemented regarding this matter, and above all, to think of the possibility that not only this webinar, but also the entire series that this group has been organizing and working on jointly can really help us in the technical capacity building area to provide tools to the official services and the representatives of different sectors in order to implement the better actions to support a national, local, and regional strategy against African swine fever. Once again, I would like to thank you. I warmly welcome you, and I urge you to continue participating in upcoming webinars, because I believe that we here are basically forming a big network of partnerships to share efforts and knowledge throughout the Americas against this terrible disease. Thank you very much. Thank you, Erica. Thank you, Ana Marisa. We will now hear the words, opening remarks from Dr. Katya Martinez. She is the sub-regional representative of OIE for Central America. Go ahead, Doctor. No, your microphone is muted. Oh, heavens. Good morning, everyone. As was mentioned by Erica, I am Katya Martinez, sub-regional representative of the OIE for Central America. It is a pleasure to greet you, to welcome you to this event. This is our second seminar, Emergency Actions in Face of the Confirmation of African Swine Fever. With the arrival of this disease to the Americas, we have a lot of hard work to do jointly, building capacity in the different countries. And there has been a big effort started among different organizations in the region of both regional and sub-regional support this initiative and collaborate jointly to seek experts to support better decision-making in all countries. It is important to welcome all the speakers also that will be joining us today. Dr. Macinos, good welcome to this event. Also with us for our people from the European Union, Cuba, the Cuban Center, Dr. Beltran from FAO, who will talk about emergencies, and this staff that has been supporting us ever since day one with Collaboration Center in Spain. Thank you very much, Carmina. It is important to highlight that all this unit and the joint effort to seek experts to better prepare the countries for this effort is basically a starting point that will help countries to develop their own plans of action and to organize their national actions, particularly because our organization, among its objectives, wants to include animal well-being and health, and above all, strengthen capacities of the national veterinary services. This will allow the countries to implement adjustments to better manage an emergency like this. It is a pleasure, and we hope that the experiences shared at the seminar will help you build your national capacities. Have a good day, everyone. Thank you, Katya. We will now hear the words by Dr. Andres Gonzalez, the animal health specialist or representative from the FAO for Latin America and the Caribbean. Go ahead, Andres. Yes, good morning, good afternoon, good evening, perhaps, for many of the colleagues that are with us in Europe. On behalf of the FAO, we would like to thank you for organizing this event. Very special appreciation to IICA and ERICA, which right from the moment we decided to coordinate the regional team for this effort, ERICA has been heading and organizing these webinars impeccably to strengthen and build capacities and strengthen technical cooperation throughout the region. As we have said on other occasions, there is a need to act in a coordinated manner. This has not only been decided, but also implemented by our regional emergency response team under GSTAC, that ever since the Africans or the reappearance of African swine fever after more than 40 years in the Dominican Republic and more recently in Haiti, has kicked off a plan, a regional action plan. Each one of our agents plays a specific role, and this has allowed that the assistance to these countries be as coordinated as possible. Unfortunately, this is part of the work we have to do. The other good part is enhance of the official veterinary services in each country, and that is why this type of activity will certainly help build capacities and strengthen knowledge that already exists, but considering the high risk that the presence of African swine fever means in the region, we need to continue re-examining basic concepts like those we will discuss today regarding epidemiological surveillance, active and passive, and how we go out and look for a case of African swine fever instead of awaiting for notifications that are not necessarily on the radar of the national sanitary services. And of course, very important is all the contribution of the diagnostic laboratory for the national epidemiological surveillance efforts. So these are very relevant matters we will be discussing today. We will hear from past experiences in our region, that we'll hear, for example, from Cuba, as well as what our colleagues from Europe will be sharing with us, where just as us is a continent that is facing the African swine fever. So from the FAO and as part of the regional group to address the African swine fever emergency, I would like to greet all participants and wish you a very successful webinar. Erica, back to you. Thank you. Thank you, Andres. Well, with this, we have officially opened our meeting. We would like to remind you that this training initiative is coordinated by an interagency partnership that arose within the framework of GSAP, which delegates the responsibility that IICA, together with this group of agencies, coordinate capacities in matters related to preparedness against African swine fever for the Americas and the Caribbean. I will mention the agencies in this working group. And if you want to follow them on your social media and learn more about their work, we have the Caribbean, the Animal Health, the Caribbean, CAFSA, and the World Animal Health Organization, OIE, the United Nations Organization for Food and Agriculture, FAO, the Andean Community, ACAN, the Permanent Veterinary Council of the South America, CVP, the United States Department of Agriculture, USDA, OIRSA, and a program of COPEG and the Inter-American Institute for Cooperation on Agriculture, IICA. Well, our subject matter for the seminar today are emergency actions in face of the confirmation of African swine fever. And for this, we are honored to have with us a series of experts, such as Dr. Daniel Beltran Alcrudo from the FAO, who will now speak about finding the suspicion of African swine fever, clinicals, signs, early detection, epidemiological surveillance at the farm level, passive, active epidemiological research, prospective and retrospective tracing. And we will hear the experiences of Dr. Raquel Nieto from INIA, Spain, together with Dr. Carmina Gardallo from INIA, Spain also, and they will discuss the sampling and sending of samples for African swine fever, diagnosis of African swine fever, a fundamental tool in the control of the disease. We will also have the pleasure of listening to the experience of Dr. Marius Masilius, representing the State Food and Veterinary Service of Lithuania. He will refer to actions to be implemented upon confirmation of an Asf outbreak. And lastly, we will hear the experiences of Dr. Maria Irian Percedo from Sensa, Cuba, who will talk about eradication, the experience of Cuba eradicating African swine fever back in 1971 and 1980. So with this, we will now open to our first speaker, Dr. Daniel Beltran Alcrudo. Dr. Beltran is a veterinary epidemiologist, 20 years of experience in international cattle health. And for the last 15 years, he has been working as animal health specialist for the FAO. Before the FAO, Daniel was a field veterinarian in the United Kingdom during the foot and mouth outbreak and the eradication of tuberculosis in 2001 and developing the implementation of a training program on avian influenza. At the FAO, Daniel has worked both at the Rome headquarters as well as in the field. Since 2016, he has been at the regional office in Europe and Central Asia in Budapest, providing technical assistance to the veterinary services. Daniel has worked in most most aspects of managing cross-border diseases and zoonosis: risk assessment, cost, development of policies, preparation, regional surveillance, capacity building, training, awareness, and development and management of animal health databases. Although he has worked with several diseases, he has focused mostly on African swine fever. He started to work on African swine fever shortly after his arrival to the FAO, when the disease had just popped out once again in Africa, had jumped from Africa to Europe. He has developed tools on cost calculation, value chain analyses, biosafety assessment, and has been a specialist in ASF in FAO missions. With all this experience, Dr. Beltran will talk to us, as I said before, about finding this a suspicion of African swine fever. Go ahead, Daniel. Hello, thank you, Erica, for your introduction. It is a pleasure to be here with you today to talk briefly about how to react in when suspecting African swine fever, clinical presentation and epidemiological research. Basically, my presentation supplements the other two presentations we will be hearing later. The objectives of my presentation today are to examine the clinical, or recognize the clinical signs of ASF, the different diagnoses to take into account, how to carry out a clinical examination, how to carry out an epidemiological investigation, and how to use the data to improve the control programs. Clinical signs of ASF vary. They really depend on factors like the virulence, the route of exposure, the infectant dose, and the statuses of the infected area. There could be different levels from acute to subacute, et cetera, et cetera. The virus of interest today, both in Europe and Asia, as well as in the Caribbean and the rest of the Americas, is type 2, which normally appears acutely, although in some cases it could be acute or subacute, depending on the time. The first thing I would like to clarify is the incubation period. It varies also. It really depends on the virus, the host, and the infection route or path. And it could change based on it being a natural infection, which could last in that case from 4 to 19 days. In more acute forms, however, it could last from 4 to 7 days. In hyperacute, in a matter of 1 to 3 days. For purposes of the OIE code, 15 days are what should be taken into account. And here at the bottom, we see the incubation period that goes from the arrival of the virus until the appearance of clinical signs. ASF in genotype 2 particularly is very lethal, highly lethal. However, what we read in documents shows that it is not as contagious as other cross-border diseases. Here we compare African swine fever with foot and mouth and the classical swine fever. So here we see the pink, which is the swine on day 1. One virus enters and affects the virus enters and affects one swine here. And over time, we can see for example, with foot and mouth disease over X amount of time, all animals on the farm are infected. And there could be 2 deaths, for example. And that is a 100% prevalence, 2% mortality, and it is lethal in 2%. If it had been, for example, the African swine fever, after 1 week, what we would find is out of the 100 animals, only 10 are affected, 9 dead. This says the prevalence is relatively low at the beginning of the infection, and mortality is also quite low. But lethality could be much higher. Notice that. This does not spread as rapidly from one animal to another. And an intermediate case would be the classical swine fever, where the values are pretty much in the middle. Let us talk about viral excretion. It starts after 2 days after infection, usually, and before clinical signs appear. In this case, the virus can be found both in blood as well as in nasal secretions. Then in the clinical phase, the virus can be detected in all areas, tears, saliva, nasal secretions, urine, feces, and genital tract secretions. Since we see this in different organs, in corpses, we see high viral amounts. Blood also has high levels. So these are also elements that we should take into account when examining contagion or spread. Now I would like to share the clinical diagnosis. In general terms, this is a disease where the most affected swine die. Death could be sudden without any other clinical sign, particularly in hyperacute forms. In the case of ASF, all ages and both sexes are affected equally by this disease. And wild boars, which are very important in Europe, we see the same clinical signs, both in swine as well as in wild boars. Clinical signs are not always book-shaped. There are differences on the ground. Sometimes we find them, sometimes we do not. Signs are not exactly as described. And so we see big differences. In general terms, the most important clinical signs are fever, lethargic, vascular changes, diarrhea, and we have the different levels that go from hyperacute to chronic. In the hyperacute ASF, the fever is very high, 41, 42 degrees, loss of appetite, lack of activity, and sudden death, perhaps before any other clinical symptoms are seen. That is why the first ones to die should be the main target at the time of sampling. This type of presentation it can see in the countries that were recently affected, where the animals are just starting. And we have the acute ASF. It takes a bit longer. Incubation period is a bit longer, 4 to 7 days, rarely up to 14 days. Fever, 40 to 42 degrees, loss of appetite, increase in respiratory frequency, drowsiness, weakness. They can just lay down, and they could have perhaps non-specific clinical signals, and nasal secretions, conjunctivitis. Death occurs 6 to 9 days later, or 11 up to 15, depending on the virulence. Lethality is 90 to 100%. So here we are talking about lethality once the disease has affected a population. If the disease is detected early, then lethality and mortality will be much lower. I would like to remind you that the signs are the same in wild boar as well as in swine. I will show you a series of photographs with the most typical clinical signals. Cyanosis, this coloring, particularly around the ears, necrotic lesions at the abdomen, neck, ears. We find The skin here, notice all red, particularly in the abdomen and hind legs. Clinical signs in Wabor are basically the same. And since these are dark-skinned and covered with hair, the change in color basically there are differences. It is these are much different here. In the subacute ASF is caused by moderately virulent viruses and can occur in endemic regions. Clinical signs are less intense in general. And fever fluctuates. There is depression, loss of appetite. It is painful for them to walk because of the pain in joints, difficult breathing, pneumonia, pericarditis, and we can see abortion and all phases of gestation. Death in a matter of 7 to 20 days. Final lethality is 30 to 70 days in survivors. The survivors usually recover in a matter of 1 month. And the chronic, I'm not going to talk too much about this because this is not what we could expect in the Americas. This presentation occurs basically in countries where the disease has been present for many, many years. Here we have postmortem lesions, 3 organs affected. Basically, when we talk about postmortem lymphatic gangles, there is hemorrhage, they are enlarged. And we can see how they are dark here. The normal tissue would usually be white or pinkish. The next spot, the next organ is the spleen. In infected swine, it is usually enlarged, very fragile. The infarction areas with darker portions, the uniform color is very different from that of a normal spleen. And the third organ affected is usually kidneys, with a significant spots in the cortex here. Notice that. And other postmortem lesions are hemorrhage under the skin, excess liquid in the heart. There is a pericardium. Lungs could present congestion and foam in the trachea, and in other bodies, in the stomach and intestine, we can see ecchymosis and hemorrhagic congestion in other parts. In heart and lungs, pulmonary edema shows consolidation in pulmonary tissue, excess liquid in heart and other cavities. In the heart, hemorrhagic lesions, and in lungs, congestion with foam in the trachea, the bloody foam. The bloody foam comes out through nose usually. In intestines, liver, and bladder, hemorrhagic lesions. And once again, I would like to remind you that in Wabor, basically, we can see here the images of the damage in the different regions. This could appear like a typical lesions on the skin, redness, but none of these photographs is really related to the African swine fever. I just wanted to show you these images to highlight the importance of differential diagnosis when we talk about ASF. There are many diseases with clinical signs similar to ASF. we cannot confirm this presence only based on clinical signs. Basically, we should continue to work on this. I see I missed the most important one, which is classical swine fever, obviously, but other like adjusty.
In terms of differential diagnosis, oftentimes it is easily confused with other diseases that are maybe acute as well. The clinical diagnosis is particularly difficult during the first stages of the disease, when there are only a few animals infected. All the suspicions that reach the veterinarian should be treated as if it was ASF. It's much better to have false alerts than to allow for an outbreak of ASF to remain undiagnosed for a long time. And also to say that this diagnosis, for it to be concluding, it needs to be confirmed by the lab. When carrying out a clinical exam, you need to follow a number of stages, and it is very important to adopt a methodological approach to carry out this clinical exam in a place where you have suspicion of ASF, maybe at a farm, a slaughterhouse. It is very important always to follow the personal biosecurity procedures so that the veterinarian is not the responsible person to spread the disease. The first step would be the clinical history, trying to obtain an answer to the following questions. When did the clinical sign started? How many pigs or swine are in the farm or the affected area? And how many of them have already been affected by the disease? Are there other species in the same facilities that are being affected? This will also help carry out a differential diagnosis, which are the clinical signs observed, and if there are any recent practices or any recent changes in the way animals were handled, so that suspicions may be raised on how the disease may have come in, and also carry out this differential diagnosis. Obviously, when we confirm this ASF, we need to carry out a more detailed investigation of the outbreak, and I'm going to talk more about this later on. Then it is very important also to look at the facilities, check the facilities where the animals are being kept, how many different groups are there, and which groups have been affected, which haven't, when did it start affecting the groups. And when examining the animals, it's better to do so at a certain distance. Look at their behavior, what clinical signs are they showing, how many of them are being affected, and which are worse or more advanced into the disease. And then in this way, we can select the animal we will be using for a more detailed exam. In the physical test, it is very important, first of all, to avoid any lesions, both in the personnel and the farm, and also the veterinarian who may be doing this investigation, and also to maintain the animal well-being. It's important before we begin to have all the equipment ready and available, particularly when handling the pigs, which may be a mission impossible when these are adult animals, and if we don't have all the right material handy. We need to have safe and adequate handling facilities, and the personnel who carries out this activity should be well trained in how to handle and test pigs. And it is always important to take the temperature of the pigs, even the animals who may not be showing any clinical signs, because they may be already in the first stages of the disease. Fever is the very first thing we see in them. Now, the very last two stages, we have a sample taking that is going to be covered later on by Dr. Nieto, but it's also important to take notes and samples and pictures. Again, very, very important to take detailed notes and pictures, drawings of the farm, etc. And with this, now I'm going to talk specifically about the research of the outbreak or investigation of the outbreak, which has to do with what I just mentioned. So in some cases, and this may sound a bit repetitive to you. It may be repeated from the clinical exam, but I'm just going to go ahead and say it again. This is an investigation that is also done as an epidemiological investigation that it combines standardized procedures for data collecting and scientific methods in order to understand the behavior of the disease. The idea of this type of investigation is to answer questions such as for how long the disease has been present, where did it come from, and where can it have spread to. And the research for the investigation of outbreaks are critical to guide the implementation and monitor the impact of the control measures of the disease. We also need to define a few words from the epidemiological standpoint. A case is an infected animal by a pathogen agent that may be showing or not clinical signs, and we need to differentiate between suspicious cases and confirmed cases. And the most important concept is the one of epidemiological unit. This is a group of animals, it's a unit in which all animals pretty much have the same likelihood for the exposure to a pathogen because they share the environment or they have a common handling. And then we have the outbreak, which is the occurrence of one or more cases in an epidemiological unit. Then the definition needs to include all the animals that have a similar risk level or exposure level. And this would include all the animals under the same handling or the security facility. The idea to define the epidemiological unit is key when controlling the disease. Depending on how we define it, then we will also be defining certain containment measures. They will be more intensive or less. So that's why we need to take this into consideration and do it very carefully and rigorously. What I want to show you here is the unit that is just maybe the first unit is a farm, commercial farm with pigs, which is maybe isolated in other cases. When we talk about low biosecurity, backyard units, we can consider that the epidemiological unit may be an entire population, a whole town, where you may have small producers with very little biosecurity, and in other cases, they may also have some animals who may be free during some times of the day. But in some cases, as we may see here in the top part to the right, the epidemiological unit may be a single backyard farm if the animals are confined and if it's relatively isolated. Now, since there's a risk for spreading, it is important to do a broad investigation of the outbreak in the surrounding areas. As I was saying before, defining the epidemiological unit is key to be able to define control measures, particularly when we're talking about maybe culling, because if the unit is very limited, we may find ourselves not having the right effect from the culling, and maybe there are animals that have been exposed to the pathogen and have not been included within this epidemiological unit. Therefore, the disease might continue spreading without us realizing. So, on the contrary, if the epidemiological unit is way too big, and if we're including animals that have not been handled similarly and have not been exposed to the same level, then at that point we will be killing many animals, and in the end the cost is going to be very high, not only from the economic standpoint, but also from how we affect the farms. These epidemiological units will probably have to be extended if we see any links between different production units. This is particularly in the case of backyards, and if we're talking about different backyard units within the same town with very little biosecurity, that might happen. But also in integrated farms, who may be having constant communication of personnel, vehicles, etc. When investigating an outbreak, we can look at 8 steps or stages. First of all, we need to establish the existence of an outbreak. And this may begin with the visit to a pig farm where there is a clinical suspicion. Usually, it is based on a notice by the owner of the facility or a private veterinarian. In some cases, particularly in countries that have been infected, it may be a positive result from the lab due to sending routinary samples. And that's when there are farms that are part of an early detection scheme that send periodically samples of all the animals that have died in the facility, just to keep good control of them. Not all notices that reach a vet will be an Asf case, of course. It may be something else. The number of suspicions reported is a good indicator of the level of alert. When a country throughout a period of time has not reported anything, it means that probably the veterinarians, transporters, and farmers do not have enough awareness of the possible entry of ASF. Because as we see, the presentation of ASF is not very specific, and oftentimes many other diseases that may look similar. And so since we're not receiving anything, probably there's no good communication between the farmers and the veterinarians. And as I have said before, it is key also to look at all suspicious cases as soon as possible. In the facilities, it is very important to confirm the disease. It can be confirmed or discarded based on clinical signs, pathological lesions, epidemiological findings, and particularly positive laboratory tests. And we also need to take into consideration genotype 2. Some pigs might die all of a sudden without presenting any type of clinical sign or lesion. And then we also need to take into consideration the differential diagnosis. And finally, we also need to highlight that the sampling for laboratory tests is the only way to discard or confirm ASF. Then we need to define and count the cases. Once we have seen that there are animals that have been affected, it is very important to establish the definition of an ASF case. This definition is developed by the veterinary services, and we separate the suspicious cases versus confirmed cases. Suspicious cases, the definition may vary, but we talk about the evolution of an outbreak or during an outbreak. And the idea is to facilitate the implementation of control measures in a speedy way. And then confirmed cases, they always need to include the confirmation from the lab. We have a number of examples of suspicious cases of ASF. This is not a hard rule for all cases. It needs to be defined depending on the diseases that are available in the region and other characteristics. Then the next step is to count how many suspicious cases we have in this epidemiological unit, and to have a more precise counting after the lab confirmation. We can establish a timeline to establish for how long or when this outbreak started, and to see how many animals have been affected from the very beginning. And that is a truly valuable information in the field, in the farm or epidemiological unit. We need to record the number of pigs and the number of dead and diseased animals. Dead and sick animals, sorry. Then we have to define the population at risk. This is the population of animals that were exposed to the virus directly or indirectly. And then the population at risk depend on different factors, like depending on the system of production in the outbreak area, the infrastructure, and social factors. To be sure, animals that may be susceptible within this epidemiological unit that has been affected should always be considered as part of the risk population. And the animals that are within the protection area that is usually defined as 3-kilometer radius where restrictions are also applied may be or not at risk, and they need to be inspected as long as there are epidemiological links with the affected farm. The fifth step is to define the outbreak in terms of the affected animals, the place, and the time. We need to count the number of animals. I already mentioned that in step 3. And then we need to define the age, sex, the breed, and the type of production. In the case of genotype 2, there's no difference between, affects animals regardless of their age and sex and everything. But we see that some pigs may be affected more than others. And we need to take a record of the production system and the clinical signs of lesions and other relevant information. And then if we have a map of the place, that'd be great. If you don't have it, you can draw one. We can also look at satellite images online. And then we can also have geo-coordinated images with GPS, with your cell phone. And before, it has been seen that sows tend to be more infected. And in second place, we also assess the level of biosecurity in the farm or the town, and we need to record which are the physical measures, like yards, the location of neighboring animals, roads, sites of entry for visitors, inspection, etc. And regarding time, we need to define when the pigs died in the farm. That's pretty much the information we need for them. The most important sources of information would be the mortality records that are not always available, of course, especially in the case of backyard animals or non-commercial areas. Oftentimes they don't have those records. Now, the second source of information, most useful source of information, would be interviews. Of course, when you carry out these interviews, we always have the problem that if certain time has gone by, the information might not be as precise as it would have been if we have done these interviews earlier on. And the objective of this is to establish the moment in which the virus entered for the first time this epidemiological unit. And that's why we need to determine the high-risk period. High-risk period is pretty much the time that goes between the time the virus was introduced and the investigation of the outbreak. This is when the virus might have spread itself without being detected. And to determine this high-risk period, we need to determine the different sources of the disease, as well as combine this with the information we may have or the knowledge that we may have of the incubation period. We need to look at clinical findings, records, like I said before, interviews, and also laboratory results in the case that those may be available. Also, the size of the farm may also be important to determine this period, because the most important farms usually have a large population of pigs, and as we saw in the chart, they may have some regular mortality rates that may be completely normal. So when the first animals die because of ASF, they may not be detected, and more time may go by between the time the disease appears and it is detected. And because of this, the sampling of dead pigs of more than 2 months old may be very important. Or this is important for PCR and tests. Here we can see the epidemiological curve. If we have the outbreak, to see what the status is. And once we have all the information, the next step, and the most important one probably, is to analyze all the information and establish a hypothesis of where the disease came from. We need to also do some backtracking and then see where it may have spread it to. And it is important to follow up forwards as well, because this is key to control the disease. It allows you to identify other affected farms and implement appropriate control measures. Now, we need to look at all the contacts in order to track the source and the spreading. We need to identify the source and possible propagation and identify all the contacts during this high risk period. The incubation period in the natural inspections may be 4 to 19 days, and the excretion of the virus may occur from day 2. So in all that time, we need to look from the moment of incubation to the moment where the veterinarian arrives, which have been the contacts of the farm. And here I mentioned the most important contacts, mainly living animals, live animals, or in the boundaries, limits of a farm where they may be nose-to-nose contact with wild boars or free animals. And then another important contact would be when they feed on trash or leftovers, or that because they can have access to trash. The people, veterinarians, intermediaries, hunters, workers, other pig farmers that may visit this farm, and objects that may be equipment, machinery, agricultural machinery, vehicles, which is an important way to spread the disease and the heterogenic transmission. Then for the sources of information for traceability, we have the interviews for the producer and the farm personnel. For this, it's better to have an structured questionnaire, and also to know the techniques to be able to carry out their surveys, because it's a very stressful moment for them. So it is very important not to skip any sort of important information or leave it out. It is also important to look at the records of movement, of invoices when animals have been sent elsewhere, but they may not always be available. It's very useful, but not always available. And you can interview some of the visitors. And from this, we need to note some observations, test the facilities, work around the perimeter to see how the fences look like, do some aerial imaging or some drawings of the area, and look for evidence of whether they have been eating residues or other things, and pictures. And once we have all this, we can develop a hypothesis of which has been the most likely source of entry, and we also identify which are the farms from which it may come or where the disease may have spread to adopt the necessary measures. And the very first moment we hear about ASF, we need to adopt control measures. And I know somebody else will be talking, like Dr. Macias will be talking more about this later on, so I'm not going to go into details into this, but we need to do a final report to summarize the findings according to the requirements of national legislation and develop a good contingency plan, or act according to the contingency plan. And this is very important. Why is it important to write a report of all the information? Well, because then it can be compared to other outbreak investigations. Oftentimes, these investigations have other practical uses aside from control purposes. So this information is good to guide and assist control strategies. They can help us see the main reasons why the disease is spreading, and therefore adjust our strategy accordingly. The information of all these outbreaks can also be used to map, of course, in a spatial way, in a map where the outbreaks are. And then we can also take a look or identify the risk groups and assess the spreading. And then we can also develop an epidemic curve to see whether we're still in the ascending phase, if we're already in the plateaus, or if it's already passing, or also identify the times of greater risk. when or the seasons of higher risk, especially if it has been there for a year, and then identify risk factors. This is very important because no book is going to tell us exactly which is the epidemiological behavior of ASF in our country. So if, for example, you see that the feeding with scrap food is the most important source, then we need to improve communication to prevent people from doing this and feeding them this way. So this has to be done constantly and always keeping up with keeping it updated. With that, that's the end of my presentation. Thank you very much for your attention. Well, thank you very much. An excellent presentation, Daniel. Thank you very much. Truly admirable how you were able to summarize all the different steps that need to be followed when faced with an outbreak of ASF. I would like to remind our audience that this is a general overview of all the different measures that need to be adopted in case of a suspicion. And later on, during these webinars, we will be mentioning each of the topics that Daniel mentioned more in detail, each one of them. So thank you, Daniel, once again. Your presentation was excellent. So now we will be going into the next presentation on diagnosis by Carmina Gallardo and Drs. Raquel Nieto Martinez from INIA in Spain. I'm going to introduce them so that both can have their presentations one after the next. Dr. Carmina Gallardo, I apologize. I am told that before mentioning the bio, I need to mention the names of the countries that have been reporting themselves via the chat. So we have people from Panama, Colombia, Guatemala, Paraguay, Peru, Ecuador, St. Vincent and the Grenadines, Bolivia, Brazil, Mexico, Nicaragua, El Salvador, Honduras, Argentina, Costa Rica, Uruguay, Venezuela, and Haiti. Oh, and we see somebody else saying hello from Jamaica as well. So I would like you to continue telling us where you're connecting yourself from. So Carmina Gallardo has a degree in pharmacy by the University Complutense de Madrid.
Es que va primero, Raquel.
So I'm going to introduce yourself. Introduce both of you. Don't worry in what order.
Vale, vale.
Bueno, como les decía, la doctora Gallardo también tiene un doctorado en ciencias y especialidad en biología molecular de Madrid, España, y con la tesis titulada Desarrollo de nuevos métodos de diagnóstico serológico y molecular de la peste porcina africana. Desarrollado en el Centro de Investigación en Sanidad Animal, el CISA INIA Madrid, España, desde el 2003 hasta el 2009, trabajó en el International Research Livestock Institute, ILRI, en Nairobi, Kenia, en colaboración con el INIA.
Nairobi, Kenia, developing studies, research studies on diagnosis and molecular epidemiology and
transfer of technology on African swine fever
in regions
of Africa,
sub-Saharan Africa. Sorry. Since 2009, Dr. Gallardo has been working in CISA INIA,
for the FAO Reference Center since 2011. There have been contributions to African swine fever, developing new detection methods and genotyping that for many years have been of reference for national laboratories in the European Union. These are recommended in the OIE manual. It is also worth mentioning the work she has done in research on development of vaccines against African swine fever, pathogenicity, and evolution of the virus. Throughout her career, Dr. Gallardo has been involved in more than 30 different projects, national as well as international, related to the African swine fever. As a result of this collaboration, she has produced more than 260 publications, scientific and technical, and 217 presentations in congresses, conferences, and international meetings. She has also participated in more than 40 international courses on African swine fever organized in Europe, Africa, Asia, and Central America and South America, oftentimes as coordinator. Since 2014, she is part of the group of experts of the European Union for African swine fever and has participated in veterinary teams of community emergency in response to Asf outbreaks, and in Europe in response to different outbreaks. Dr. Nieto Martinez, Raquel Nieto Martinez, is a licensee in biological science from the Autonomous University of Madrid. Since 1999, she has been working at INEA, developing professional activities in laboratory diagnosis of animal diseases and technology transfer on African swine fever. Since 2006, she has been working in technical activities in reference laboratories for INEA, European Union for African swine fever, and the reference center of FAO since 2011. Throughout her career, she has been involved in more than 20 projects, national as well as international, related to African swine fever. And as a result of this collaboration, she has participated in different scientific and technical publications and publications at different congresses and international meetings as well as national. She has participated in 39 international technology transfer courses related to African swine fever. Now, now I offer the floor to Dr. Nieto Martinez for her to share her presentation. Can you see this clearly? Please let me know. Yes, perfectly well. Thank you, doctor. Thank you. Well, thank you all. Good morning, everyone. I will talk about sampling and sample take and sending samples to laboratory for laboratory diagnosis of African swine fever. Okay. As to sample taking and submitting is very important for the sanitary surveillance because it aims to provide rapid and reliable information to enable actions related to prevention and control of diseases. An essential component in a surveillance system, we have the official diagnosis laboratories. These are entities within the national and international surveillance and sanitary structures, and they are essential. Excuse me, just a minute. Excuse me. Can I go back one? Can't you go back? Oh, okay. Here we go. Thank you. As I was saying, they are both national as well as international, are essential to confirm the sanitary status of the animals, and identification of pathogens, and early detection of animal diseases. So it is rapid and reliable and is very necessary for the prevention and control of any diseases. The objective of diagnostic testing is to determine the absence of a given disease in a country or given region, avoid its spread through trade, which is so important, confirm the diagnosis in clinical cases, and identify infected animals to implement control measures. The most convenient ones estimate the prevalence of an infection to facilitate risk assessment, eradicate an infection in a region or area or country, classify the animals according to their health or immune status after vaccination process, and also are a tool to continue to follow the evolution of a disease and thus facilitate fighting against that disease. The role of data collection, sample taking is very important to submit to the laboratory, and we can detect antibodies and viruses. And based on the techniques we use to detect antibodies, we need both serum as well as blood. And we will see in a minute, basically homogenized tissue from Diana, spleen, kidneys, lymph nodes, and marrow. And for detection of virus, well, serum, blood, EDTA as an anticoagulant. EDTA is also always required because others may inhibit the PCR technique. And homogenized tissue, basically liver, lungs, etc., etc. For a good diagnosis, we always need good samples. So an adequate sampling is required with appropriate quality, representative samples, and insufficient volume that will allow us to undertake an initial analysis, confirmation if necessary, and to keep in file or in storage a sufficient volume of that sample because it could be very valuable, and should include adequate packaging and transportation, identifying the samples clearly with adequate time to receive these at the laboratory, as well as appropriate and correct storage. Throughout the sampling plan, it is very important to consider all biosafety measures, both at the time of obtaining the samples and during laboratory work and in filing and disposal of the samples. As to the materials necessary to gather samples, well, we need containers with tight covers, preferably plastic, sterile tubes without anticoagulant to gather blood and serum, sterile tubes with anticoagulant, CDTA, the right syringes and needles, scissors, and this cold storage, dry ice if the samples need to be frozen, and water-resistant labeling systems. Samples must always be identified individually. Selecting the samples to examine, well, for serum, well, the blood without any anticoagulants, so we allow the clot to form, and hemolysis in a sample affects negatively the serological samples. Remember that the blood, we must avoid the use of heparin to not inhibit detecting the PCR, and it is preferable to use EDTA. Other organs without formalin, because this could prevent the isolation of virus. And the organs, as I mentioned, are spleen, lungs, kidneys, amygdala, heart, lymph nodes, as well as blood, bone marrow. To detect the virus, there are different techniques. One, the most frequently used, is the PCR, polymerase chain reaction, and the detection of viral antigen through immunological techniques, DIFT and ELISA, and viral isolation of hemoadsorption of VPPA. The whole blood is used, DDTA, as I mentioned before, serum, organs of all types, bone marrow, and even soft ticks that act as vectors in different areas. For the antibody detection techniques, we have a screening method. We have ELISA. The indirect ELISA is described in the manual of the OIE, and commercial ELISA is available currently in the marketplace. And the confirmation techniques are immunoblotting, the indirect immunoperoxidase technique and the indirect immunofluorescence techniques. And for all of these, we use serum in the case of confirmation techniques through IPT and IFI. We can also use fluids from bodies and bone marrow. And it is very important then to have the confirmation testing, because all positive results or doubtful results in an ELISA need to be confirmed through any of these techniques. Different studies or evaluation studies have been carried out by different groups, showing the potential use of some alternative sampling, different from those described before, to detect AFS, oral fluids, dry blood samples, and the dry sponges, among others. But these still need further validation using field samples and need to be validated to detect the virus and antibodies, because they must detect the different viruses and strains. As to the PCR technique, blood pools could be used to detect AFS and ASF, excuse me, and when there is a large amount of viral DNA below a value of 30, there is no reduction in sensitivity, but it does reduce when pools of more than 3 samples and the DNA load is greater than 30. As to transportation of samples, well, this must be done following the regional, national, and international regulations. And if it is delivered after more than 48 days, it must be transported and stored in liquid nitrogen for a longer period. Here we have a sort of template that we use at the laboratory. That must be filled out by those that submit the samples to have relative information regarding the samples submitted. Evidently, we see the information of the shipper, the return address once the results are obtained, a list of the samples submitted, the type of sample, if it is blood or serum, the type of tissue, the volume, number of samples, and other details. And each tube must be identified with the animal species the sample was taken from, the animal itself, the animal ID itself, the type of sample, as well as the sampling date and location. And when possible, any type of additional information like the reason why the samples are being sent, to confirm a suspicion, or because there is symptomatology. If there is symptomatology, what is it? And any other information. This is all very important to have complete epidemiological information. As to the requirements for transport biological materials to the laboratory, in the Chapter 113 of the OIE code, we have information on this. And it says, in the interest of human and animal health, biological materials obtained from animals must also be transported in a safe, efficient, and legal manner from the site where the sample was taken to the place where it will be analyzed, studied, or used. This requires coordination both by the shipper as well as the carrier, as well as the recipient of those samples. And for this, the infectious substances are classified. The suspicious samples are included in category B, and they carry their own code with a UN number, which in this case is 3373. The PPI virus category A, with its own identification, UN 2900, an infectious disease that affects, or an infectious substance that affects animals. And if there is doubt as to whether the criteria are met, well, it is better to assign it category A. And there's a series of exempt samples that are not subject to the hazardous substance regulations. And these are basically for surveillance purposes or for some concrete populations. The OIE manual also refers to the triple packaging system minimum recommended. Here we can see the triple packaging system for category A, a primary container where that contains the sample, and that container, primary container, goes in a secondary container, waterproof with absorbing materials to, in the event there is a leak of the primary container, and the secondary container must be in another container that identifies the type of material, the category, and other information to avoid possible accidents. In the case of the primary container is damaged. This is in the case of category A, infectious substance. For category B, the secondary container, in which the primary container is placed, could not necessarily be rigid, but must have the internal one does not necessarily have to be rigid, but the outside container must be strong and rigid. As to handling and working with suspicious ASF samples, the African swine fever virus must always be handled in the laboratories approved by competent authorities following the biocontainment guidelines for group 3 pathogens. If suspicious ASF samples come to a level 3 laboratory, well, there must be restricted areas. There must be a room specially for room to change one's clothes and shoes, decontaminate appropriately the surfaces, equipment, and materials, control both residues as samples, as well as adequate training of the staff that will be involved in handling such samples. Now, for PCR analysis, the first step to extract nucleic acids must be carried out in a class 2 biosafety cabin, which will cause inactivation of the virus, and then we can work on the laboratory table. In the case of serological analyses, sample inactivation is done through thermal treatment at 56 degrees over 70 minutes. And after inactivation, then it can be worked on normally on the laboratory table, remembering that the African swine fever virus must only be handled in those laboratories that are approved by the competent authorities in each region country. And this slide, I just wanted to show you the website of INIA, the European Union Reference Laboratory for African Swine Fever. This is the website. We have the normal work process to detect viruses and antibodies, different publications that could help learn more about this disease. And it is updated more or less regularly. There is significant information on African swine fever. This is all I have to add for the time being. Thank you. Well, thank you very much, Dr. Nieto. We will now have the presentation by Dr. Gallardo. Doctor, your microphone is off. Muted.
Ahora, ya está.
Okay, here we go. I'm sorry. My apologies.
Buenos días a todos.
Hello,
Voy a
good
hacer
morning,
como
everyone.
continuación
In
de la
continuing
conferencia que ha dado
with
la
the
doctora Nieto, voy a
presentation given
continuar
by
con lo que es el
Dr.
diagnóstico
Nieto,
de
I
la
would
peste
like to
porcina
talk about
africana,
African swine
ya que,
fever
como también ha comentado
diagnosis.
Daniel, es una herramienta
As Daniel
fundamental en
mentioned,
el
it is a
control de la
fundamental
enfermedad.
tool to control this disease.
La confirmación de un brote de peste porcina
Confirmation of an
africana,
African
como
swine
todas las
fever outbreak
enfermedades,
as
se
all
basa en la
diseases is
detección
based on
temprana.
early
Y
detection.
esta detección temprana
And this
tiene
early
que incluir
detection
tres
has
pilares
to include
fundamentales,
three
que son,
fundamental
lo
pillars,
primero,
which are,
el reconocimiento
first
de
of
la
all,
enfermedad en el campo.
detecting the
El
disease in the
segundo,
field.
el
Secondly,
diagnóstico de laboratorio, y
laboratory
todo ello
diagnosis,
combinado
and
con
all
los
of this
datos
combined with
epidemiológicos. Si no
epidemiological data.
conocemos y no
If we
sabemos
do
estos
not
tres pilares
know
fundamentales, no podremos
these
aplicar
basic
programas de
bits of
vigilancia
data, we
efectivos para el
cannot
control de la
have
peste porcina
effective
africana.
control of African swine fever.
Como ha comentado Daniel, lo primero
As
que se tiene
Daniel
que
mentioned,
saber
the
es
first thing we
conocer la
must
peste porcina
do
africana
is
desde un punto de
understand
vista
African
clínico. Y
swine
aquí yo
fever
quiero hacer
from the
un
clinical
hincapié
stance.
especial
I would like to
en que
highlight
la peste porcina
especially the fact
africana
that
es siempre
African
peste
swine
porcina
fever is
africana
always
en
African swine
cualquier
fever,
parte del mundo.
regardless
Esto es muy
of the place
importante
in the
porque
world.
no
And this is
depende
very
en ningún
important because
caso del
in no
genotipo que
case
esté
does it
circulando.
depend
Da lo
on a
mismo si es el
circulating
genotipo 1,
genotype.
el 2 o el
It could be
24 de
1 or
todos
2
los que
or
se han
24,
descrito. La
all
evolución
those
de la enfermedad
genotypes. The
y las formas
evolution
clínicas de la enfermedad
of an
son siempre
illness
las
and its
mismas
evolution is always
independientemente del
the same
genotipo.
regardless of the
Esto es porque los
genotype.
genotipos no están
Genotypes
asociados con
are not
virulencia, es un
associated to
simple marcador
virulence. These
genético.
are just a genetic
Por eso
marker.
tenemos que tener muy claro
That
que
is
da
why we
igual
must
que
clearly
sea el
understand
genotipo
that
2 circulando en
regardless
una
if it
región,
is
como puede estar
genotype
ahora
2
en todo
circulating in a
Asia,
region,
América,
as
las
is
partes en las
happening
que
in
estamos hablando de
Asia
América
and
y en
the parts of
Europa,
America
la
and
peste
Europe,
porcina africana va
African
a
swine fever
evolucionar siempre
will
igual.
evolve
Y como
in
ha
the same
dicho,
manner, always.
¿sí?
Excuse me for interrupting.
Sí.
Did you select the language channel
Español.
for speaking? I'm
pone
supposedly in Spanish.
Sí.
Have you
Sí.
selected Spanish? Okay,
¿Lo vuelvo a
okay.
poner?
No, one of the interpreters is saying that they could not hear you. Okay, but we will settle that here internally. Excuse me for interrupting. Now let me select it once again if you don't mind. Okay?
Vale. Continúo entonces.
Okay, let us continue.
Que recupere la pantalla. Aquí. Como ha comentado Daniel, desde un punto de vista
As Daniel mentioned, in the clinical stance, we will have the typical symptoms. But since it is hemorrhagic, it is easy to confuse with other diseases, basically classical swine fever, and that is why differential diagnosis when suspecting African swine fever or classical swine fever or a hemorrhagic disease is fundamental for the early detection of this disease. Not only do we have to think of clinical symptomatology, which is typical in African swine fever, because as we have said, the virus evolves. And the disease in early phases, if it is not eradicated in a country, in a given region, well, the virus will continue to circulate. There is a percentage of animals that will survive even in highly virulent outbreaks. Up to 10% of the animals can survive. These animals, the virus remains in them, and the virus will evolve over time to moderately virulent strains and low virulent strains over time. So what we will have and what we are experiencing in the countries affected is that they are coexisting with strains of different virulence. So what does this mean? Well, in the end, we will have a clinical symptomology that will vary significantly, as well as animals that survive the disease. Detection of these animals that survive the disease should not be forgotten if we want to have effective control in the countries affected. And this detection of survivors is based on diagnosis. Now, what are the foundations for good diagnosis? Well, the foundation consists of 4 elements. First of all, as Raquel mentioned, is appropriate samples. Secondly, that those samples be used with internationally validated diagnostic tests. The third is the workflow we have to follow. First, it is not the same if we are in a free zone or we are fighting against a primary outbreak, or if it is an endemic area. And even more important is the interpretation of the results. The diagnosis is not only saying whether a technique is positive or negative. No, it is analyzing the entire results we have. Because as I mentioned before, at the beginning, we will have clinical symptomatology and virulent outbreaks, and there will be animals that suddenly die without any clinical symptomatology at all. There will be a high viral load, but over time, this will change if it is not detected in due time. And we must bear this in mind if we want to have a good diagnosis and if we want to control the African swine fever outbreaks. The first thing we have to do is combine samples with diagnostic techniques, as Raquel was mentioned, in order to know in what cases we have to use what type of sample with what technique and what for. This slide, we show what we would use to detect the African swine fever virus. And this, of course, is what is used for early detection in the minimum suspicion of an outbreak of a hemorrhagic disease. The election technique is always the Pcr technique. It is the most sensitive to detect outbreaks. And here we will use all types of samples. Raquel has mentioned which these are, but we should not go without mentioning something. In EU outbreaks, we have seen that Pcr can detect African swine fever in any type of sample. Well, the Pcr will help with early detection, obviously, and it is also appropriate for movements within restricted zones. In detection of virus, we can use all types of samples, and for this we use a viral isolation and identification of hemoabsorption. This is used basically in the case of when there is confirmation of a primary outbreak of the disease. The antigen detection, the IFD, and the ELISA antigen, which is commercial, are less sensitive. The fact that they are less sensitive is basically due to that in the dynamics of African swine fever, antibodies appear very early during the infection. And these antibodies will link to the antigen and produce a loss of sensitivity of this type of technique. So that is why its use is recommended together with the antibody detection test.
This detection tests for antibodies too are key to detect survival animals and possible carriers of ASF. The test of choice, of course, is ELISA to analyze the serum, which is the most widely used test for epidemiological surveillance, but it has an inconvenience. The inconvenience that ELISA has is that it can only be used with serum or plasma. Other samples have been used, but then you get false positives and it reduces the specificity of the technique. For this, then we have a techniques, which is immunoblotting and the technique of indirect immunoperoxidase, technique of indirect immunofluorescence, which have the great advantage that they may be used with any sorts of samples. And this in the current epidemiological situation that is going on in the EU with a large number of wild birds that have been affected, in which most cases the only thing you get in the lab is samples of carcasses of animals that have been found dead. With a single sample, we will be able to determine if the virus is present, but also if the antibodies are present in case we get a negative result. These techniques For the field, just like is being said before, the field tests for detection of antigen are very sensitive in general, but they are always used in parallel with the antigen and detection techniques as well. What is the workflow for clinical suspicions? Well, first of all, of course, if we have a clinical suspicion on a hemorrhagic disease, which may be ASF, or when there is an increase of the number of dead animals in a facility, the first thing we need to do is the Pcr technique. The Pcr technique is the technique of choice for early detection of ASF and the confirmation of clinical suspicion. We have an advantage with ASF because we have many different methods for the detection of virus and the detection of the antibodies that are fully validated in the case of ASF. And in the case of the PCR technique, we have many commercial methods, as well as those described in the OIRSA, that are highly sensitive and very specific and are capable of detecting all types of outbreaks and all types of genotypes. I apologize for that noise. When we get an ASF positive result, it means that we are confirming the outbreak of the disease. So if it is a primary outbreak, it is recommended to confirm this primary outbreak through the viral isolation technique. Also, through the genotyping of the virus to find the origin of the outbreak. But what happens if we have a negative PCR result and if there is a clinical suspicion, or if from the epidemiological standpoint we feel that there's presence of AFS? Should we just discard it because we got a negative PCR? Do we discard altogether the presence of AFS? What would be the next step then? The next step in this case is that this would be carried out in a laboratory, and this would be the antibody detection. If we have a suspicion that the virus of ASF is circulating, we need to do serological tests that for diagnosis. And ELISA test is the minimum requirement. If it is a negative, you can have negative for antibodies and negative for virus. We discard the presence of AFS. It is not a confirmed outbreak. But if we get a positive result and a negative through PCR, it means that the virus has been circulating, that we have had the infection, and that we're detecting are the animals that have survived to the infection, and also this is important to be seen because they may be carriers of the virus. The diagnosis information or diagnostic information will enable us to do early detection, which is key in AFS control systems, because we can say then whether it's positive or negative, and this can help us see what the clinical evolution of the viruses that are circulating is. And we will also have the possibility, as Daniel mentioned, which is also very important, to determine the time of infection, when the virus entered a specific farm or is affecting the feral population. For that, we need to have a good interpretation of the outcomes of the diagnosis. And for the interpretation of these diagnostic results, we need to know what the dynamics of the disease. In the case of ASF, if we have some acute outbreaks, antibodies won't be developed, but we will be high viral loads that are easily detected through PCR. In time, we'll see the emergence of virulent viruses, of moderate virulent viruses, and then the viremia will start decreasing after a month. For a month and a half, we will get negative viremia results that won't be detected by a PCR, or they will be detected intermittently or in a weak fashion, but we will have a high titrate of antibodies that will be detected easily through serology. Now, if we compare the diagnostic results that we have, we will be able to provide very useful information to veterinary services, determining which type of infection, at what stage of the infection we are. If we're in early infection, before the first week, if we are in this early infection, or that is already an ongoing or current infection, or if it's a past infection. As you can see in this chart, if we have a weak PCR result, and in the serological test, we get a negative result, this means that we are facing an early infection prior to 7 days. The virus is in the facility or has been at the facility for a very short time. The animal has been recently infected and has not yet seroconverted. In this case, clinical signs may not be evident. If we get this other situation, we get a PCR positive, but ELISA is negative. In this case, IPT or indirect immunofluorescence may be more sensitive and may turn up positive. We are also dealing with an early infection, but in this case, we are already seeing some clinical signs because this is happening between 7 and 10 days after the infection started. When we have a positive PCR, we have a current infection under 10 days or greater than a month. The animal continues to be viremic with clinical signs and has already been seroconverted. If we have a weak or intermittent PCR or negative PCR, but we get a positive serology test, it means that the virus had been circulating a month before. The animal recovered from an acute or subacute infection and showed no clinical signs. And as you can see in the bottom of the screen, you can see that this very same situation can happen in animals who have been infected during early stages with low virulence strains. As Daniel mentioned, maybe this is not the case of what is going on or what may happen in the Americas, but it is what has been observed in certain regions of the EU and in China because we have some low virulence strains circulating there. Here you have how the infection behaves. So with low virulence viruses. Here, at the beginning of the disease or the infection, we will have a negative PCR or a weak PCR, but then these animals are easily detected through serology because they have a high titrate of the antibodies at a very early stage of the infection, even detected between 7 and 8 post-infection with ELISA. And it's very important to find these animals because from the clinical standpoint, they usually have subclinical infections or non-specific signs for ASF, clinical signs for ASF. So the confirmation of an ASF outbreak is based on the 3 main pillars. First, clinical diagnosis, laboratory diagnosis, and epidemiological data. And this will help us have early detection, and then we also obtain information of the dynamics of the information, the time of infection. And this is something that was seen in a specific infected area. This will help enhance the control and prevention measurements and programs. And so it is very important to have active collaboration and exchange of information between the veterinary service and the laboratories. Thank you very much.
Muchísimas gracias, doctor.
Well, thank you very much, Dr. Gallardo and Dr. Nieto. Excellent presentations. This gives us a general idea of the diagnosis part. And so we urge all participants to ask their questions via the Q&A section in the chat. And this is also being broadcasted via social media. So when people who are listening to this in the social media, send us your questions, because in the final Q&A session, we will try to answer them. We have also had reports from countries such as Canada, Barbados, Trinidad and Tobago, United States, the Dominican Republic, and Chile. So welcome all. For those of you who are joining this webinar, and just feel free to continue telling us where you're coming from. And now we will continue with our agenda. Now we will be listening to Dr. Masiulis. Dr. Masiulis will be talking about, or briefly about, let me see, I have the agenda over here. Dr. Masiulis will be talking about the actions to be implemented upon confirmation of an outbreak of ASF. Let me tell you briefly about Dr. Masiulis. Dr. Masiulis, after his veterinary studies, he obtained a PhD in the animal reproduction field. Since 2008, he started to work in the State Food and Veterinary Service as the deputy head of the Animal Health and Welfare Department. After 4 years, he moved to the department and has been leading it until today. As head of Emergency Response Division, he coordinates the control of contagious animal diseases, and he is responsible for drafting and renewal of the national contingency plans. He is deeply involved in the drafting of legislation regarding animal disease control measures, including biosafety requirements for pig keepers and hunters due to the African swine fever. During his professional years, he had been involved in the eradication of classical swine fever in 2009 and 2011. And since 2014, he has been involved in ASF surveillance, control, and eradication in domestic pigs and wild boars. Dr. Masiulis has participated also in different trainings, workshops, and e-learning related to ASF. He is a member of different task forces or task force groups and scientific committees. He has provided training to private official veterinarians, hunters, and beekeepers regarding ASF. And for 11 months, he worked as the contingency planning officer in the European Commission for the Control of Foot and Mouth Disease, Food and Agriculture Organization of the United Nations in Rome, Italy. FAO. So, without further ado, I give the floor to Dr. Masiulis. Dr. Masiulis, please go ahead with your presentation.
Thank you very much, and hello to everyone. Thanks firstly for the organizers for this invitation to be a part of this webinar. And today I will try to present some general measures and actions when the country should take in the case of suspicion and after the African swine fever outbreak is confirmed. I will deliver my presentation in English. And of course, I will present the experience of the one European Union country, so that would be my country, which has been in 2014 officially reported the presence of African swine fever in the eastern part of the EU. So here you can see the map. So this map is created and represents the cases and outbreaks, as well as the affected regions and countries in 2021 and nowadays. So as you see, many countries already suffer from African swine fever, but the situation differs. In Europe, African swine fever is mostly related with the outbreaks in the wild boars, However, in the other part of the world, mostly the outbreaks are connected with the movement of the sick domestic pigs and, of course, contaminated their products. So what should be done? And I will try to present the general measures which has been proven as successful in the control of African swine fever. So first of all, we should think about the suspicion. And in the European Union, we have very clear rules for the farmer. What the farmer, firstly, should do in a case of suspicion. Of course, isolate all animals which are suspected of being infected. Implement appropriate additional biosecurity measures to avoid any risk of spread of the disease. Cease all movements of the susceptible animals from or to the establishment, and prevent non-essential movement of animals, their products, any materials or substances, as well the persons as means of transports from or to the establishment. Of course, the farmer has the obligation to ensure that production, health and traceability records of the establishments are updated, and to provide the competent authority, competent veterinary authority on request with any relevant information regarding the disease, and to follow the instructions given by the competent authority. So there are very clear rules. Do not enter the premise which is suspected, and do not move anything out. So what the veterinary service should do in a case of the suspicion? Of course, firstly, to ensure that the official veterinarian perform clinical examination on the kept animals in the establishment, and to collect all samples from laboratory for laboratory examination. Of course, not only clinical examination and the samples collection prevent the spread of the disease. The official veterinarian or the veterinary service should place the establishment under official surveillance and immediately impose the following preliminary restriction and biosecurity measures. And again, you will see prohibition of movements of animals. That's very important. The animals from the suspected premises should not be moved out. As well, prohibition of movements of any product, material, or substance likely to be contaminated should not leave the holding. The animals should be isolated and protected from the wild animals. In the case of the Europe, we have a large population of the wild boars. So, of course, domestic pigs should be closed, isolated, and protected from the wild animals, and when necessary as well from the insects and rodents. It should be prohibited to kill or to slaughter the pig. Why? Because in case the pig is sick and infected, so with the performing the slaughtering or killing and delivering the products outside the infected or possibly infected premise, so it can spread the disease further. Again, prohibition of non-essential movements of products, materials, substances, as well persons and means of transport into the establishment should be in place. And what is very important, the competent authority may establish, even in a case of suspicion, a temporary restricted zone and impose some actions while waiting of the result from the lab. So we have the confirmed outbreak. So what should be done? The first step, official ban to move pigs. And this ban can be done, of course, firstly from the already affected outbreak farm, but it can be from the zone or even from the region or country. To start the traceability of dispatched pigs and farms in contacts, that has been already mentioned by Daniel, to set the protection and surveillance zone with a temporary movement ban within the zone or outside the zone, and to activate the contingency or the action plan starting to control the outbreak farm, imposing biosecurity measures, to start the epi investigation. Of course, the infected farm should be killed, culled, the carcasses should be destroyed, and the cleaning and disinfection should follow all these activities. So, what is clearly provided in the legislation, and what has been done in all the European Union countries affected by African swine fever? Firstly, all susceptible animals which are in the establishment shall be killed as soon as possible on the spot, in such a way as to avoid any risk of spreading the relevant disease agent during and after killing. That means that there is no possibility to slaughter the pigs and to deliver the meat into supply chain. All the pigs should be killed and safely disposed. Appropriate and necessary biosecurity measures shall be taken to avoid any possible spread of the disease, and bodies and parts of the animals which have died or which have been killed shall be disposed of. As well, all potentially contaminated products, materials, or substances which were present in the establishment, they should be isolated until they are disposed or processed, or until the cleaning and disinfection measures are completed, and after the disposal is completed under the supervision of official veterinarian. Then the competent authority should establish the restriction zones. Protection zone, which is based on the minimum radius of 3 kilometers, and surveillance zone, which is based on the minimum radius of 10 kilometers. But it is the possibility for the competent authority, if necessary, based on the risk assessment, to establish further restricted zones around or adjacent to the protection and surveillance zone. And of course, the measures applicable in the further restricted zone should be same as for the surveillance zone. So, what are the duties of the competent authority in the protection zone? So, first of all, to compile and keep up to date all establishments keeping animals which are sensitive to African swine fever, including their categories and number of animals in each establishment. So, to perform the census of animals. So then, to prevent the spreading of the disease and based on the available epidemiological information and other evidence, it is possible even to implement preventive killing or slaughtering of pigs in the establishments located in the restricted zone, if the competent authority decides that this is necessary to stop the further spread of African swine fever. Order and to supervise all movements of the entire bodies or parts of the dead, wild or kept animals for processing and disposal, and of course to prohibit all activities inside the protection zone, firstly including the movements of the live animals and their products. So this is again very, very important measure, because with the live animals or with the contaminated their products, the disease can be spread further in the country. And of course, the duty is to ensure that the official veterinarian would carry out at least one visit to all establishments, to all pig farms located in the protection zone. And the minimum duration of the measures in the protection zone in the EU, it is 15 days. The measures in the surveillance zone is very, very similar. Again, so that's the general measure, but it is again cover the prohibition of the movement of the animals, their products and other material from and to the surveillance zone. Again, the visits, official visits, to perform the sampling of the establishments in the surveillance zone, but in the surveillance zone, those measures, the minimum period of the duration is 30 days. So that means that all these 10 kilometers should be under the official supervision of the veterinary services for at least 1 month. So we have different measures and we have established the zone. So then we should start to plan and to conduct the culling. Of course, first of all, we should choose the best method. And when you make a choice of the method to apply, you have to be very aware of the limitation of that method. So there are some of the question lists or the questionnaires which can make you perform a choice. First of all, you should know how many animals are on the affected farm, what are the housing conditions. So if you decide the killing methodology, are there any limitations to perform this methodology, to perform these killing methods? Which methods are available in the countries? We know that there are different methods and not all those can be implemented in any of the countries. Of course, we should understand what capacity should be needed, how many people, how many personnel, how many equipment, and what are the other consequences for the rest of the contingency plan. Of course, we should bear in mind the safety. We should respect animal welfare. We should know the costs because, of course, all those methods are costly and expensive. How the carcass removal will be performed. And, of course, we should not forget about the biosecurity. So the challenge is how to manage the domestic pig killing in the case of African swine fever outbreak. I have listed a few methods, so lethal injection, captive bolt, electrical stunning equipment, or CO2 gas, carbon dioxide. So, of course, it can be used alone or in the combination of different methods for the different animal categories. But just, I will not go in very details. I am aware that you will have the further webinars which will present. So those killing methods, but I just listed them. Of course, this lethal injection and anesthetics which are used for the pig euthanasia varies over the world. So there are different commercial names. So I have just presented a few examples which have been used in the European Union. Most of the countries, they do not use the lethal injection because of course anesthetics are very expensive. Most of the countries prefer captive bolt, so penetrating captive bolt, which of course penetrates the skull and kills the pigs. Again, there are some limitation of the method because it's different to kill the adult sow or boar, and it is not used for the piglets up to 5.5 kilo. Electrical stunning or killing equipment, it's widely used. Again, it should be used with the precaution because the work is dangerous. The environment, so there can be of course a wet and it can leak some electricity. So of course the personnel which work with the electrical stunning equipment should be trained, should be prepared, and they should work in a team. CO2 gas, actually it is widely used, especially in my country. From the beginning of African swine fever in 2014 up to 2020, we have had 141 outbreaks. Mainly they were backyard farms with several pigs. Of course, those pigs were killed with the electrical stunning equipment or captive bolt. But during the history of African swine fever, we had 3 large commercial farms affected. So one was close to 20,000, and the rest 2, there were almost 25,000 of pigs inside. So of course, to kill such a large amount of the pigs, CO2 was the preferred method for us because you can use not the special containers, but rebuild some of the typical vehicles which were mainly used for the grain production or for the feed. So they should have a soft roof. The pigs are chased inside. CO2 can be applicable for the different age groups. Again, the roof is closed, the tubes are connected. In the Europe, the CO2 gas is delivered in such as cylinders up to 55 kilo each, or in the large tanks from several tons up to 20 tons. So they can be easily connected, and then the gas should be blown in. The concentration inside should be reached up to 80%, and that is enough to kill the pigs. Then when the pigs are killed, of course, we should think about the disposal. And the most common disposal methods for carcasses and other materials are burial, cremation or burning, either on a pyre or a pit burner, rendering incineration, composting, and disposal by alkaline hydrolysis. In the European Union, it is only possible to use burial, burning, or rendering and incineration. But the burning, again, is not very popular or not allowed by the Environmental Service. The challenges are always in place because we should think where to store the carcasses. If we kill quicker, then we can dispose. So what to do with the carcasses? To burn them, to bury, to render or incinerate. And of course, we should not forget about the cleaning and disinfection procedures in order not to spread the virus further. Disposal, of course, when we have in mind the disposal, we should think about the occupational health and safety. The method should be suitable to inactivate the pathogen. We should concern about the environment. Capacity should be available. Of course, the funding, adequate staff resources, societal acceptance and acceptance from farmers. And the method should prevent from scavengers and different vectors. And of course, we should think about the economic impact. As I said, how to manage the pig disposal, to render or to incinerate, to burn on site, or to bury on site. In our case, we were lacking the rendering capacity. We have only one rendering plant in our country. And actually, it is not sufficient to render all the pigs killed in the commercial holding with more than 20,000 of pigs. So the burial on site was the only option for us. So what we did, all our farms, according to the national requirements, should have the approved and agreed with the Environmental Service, the place where in case of emergency, the pigs would be buried. So that's the one example of the farm infected with 25,000 of pigs. So they have had already burial places agreed and approved on the site. And when the outbreak was confirmed, we have used this land to perform the pits, to excavate the pits, to make like a tranches. And after all the pigs killed were placed here in the layers. Of course, we are mixing the layer of the pig with the contaminated feed or bedding material. Again, so such a layers, they are very suitable for absorbent for the different fluids which appears from the cadavers, and you can make up to 3 layers. Of course, it depends from the size of the pit and from the burial capacity. After everything has been filled with the soil, so actually the pit should be designed in such a way that at least 1.5 up to 2 meters should be above the final layer of the carcasses. And if everything has been done in the proper way, so there are no huge problems with such a burial places. Of course, they cannot be used for the long time because of the numerous of the carcasses buried. So it take much longer, but and actually those land cannot be used for at least several years for the same burial purpose. And of course, when we have killed the animals, we started to safely dispose them off. We should think about the cleaning and disinfection operations. And of course, the measures to destroy the rodents and insects. All this should be done using officially authorized products and must be carried under official supervision and in accordance with the instruction provided or given by the official veterinarian. So the disinfectants which are used for such a purpose and their concentrations must be officially approved by the competent authority, and of course it should target African swine fever virus. Efficacy of the disinfectants must be regularly checked before usage, as the efficacy of certain disinfectant is diminished by prolonged storage. So, how we perform the cleaning and disinfection in the European Union? Actually, it is done in the several stages. The first is called preliminary cleaning and disinfection. So you just simply spray the disinfectant on all the surfaces, and it should remain there for at least 24 hours. Then the second stage of the cleaning and disinfection start ongoing. So the manure and used bedding must be removed and treated. Grass and dirt must be removed from all the surfaces by the application of decreasing agent and washed with water. And after the water, so then the further spraying with disinfectant must be applied. And those disinfectant should remain for the 7 days. So then the final stage, after 7 days, the premise must be treated again with the decreasing agent, rinsed with the water, sprayed with the disinfectant, and rinse again with the water. So then we can consider that the cleaning and disinfection has been done in the proper way. So what to do with the contaminated bedding, manure or slurry? So manure and used bedding must be stacked to heat, sprayed with the disinfectant, and left for at least 42 days, or can be destroyed by burning or burying. So it can be done by the company or can be done by the certified or trained staff of the veterinary service. Of course, all the time when the carcasses are temporarily stored, they should be also disinfected in order to prevent the mechanical spread with the different baiting insects or flyers. Even we have regularly disinfect the road where the cars or trucks with the carcasses are going to the burial place. And usually it is very sensitive and a lot of questions appear what to do when we have the wooden farms. So that's mainly with the backyards. Of course, the procedure is the same, but we do not allow to restock the pigs for at least 1 year in such a wooden stables, because it's very difficult to properly clean and disinfect the wood, and of course to stock such a stable as you can see in the picture with the disinfectant is really very, very difficult. After each stage of the cleaning and disinfection, it should be sealed off with the visible signs that the disinfection has been performed, and it is forbidden to open without the permission of the official vet. Here's an example of the commercial farm. Of course, all the equipment are removed for even the feeders, air flowers, and actually water system. So everything is removed, cleaned and disinfected. Again, even the metal constructions, so they are removed and after the proper cleaning and disinfection. So after this all three stages elapsed, so then we are checking the efficacy of the disinfection by taking the samples for the microbiological evaluation. All the equipment used, including machineries and other containers, everything is properly disinfected, and even some of the farms, they use lime to disinfect the outside of the farm. So that was the general presentation. I'm sure that you will have more details when you will have that special webinar on the particular actions as regards the cleaning, disposal, and of course, killing of the pigs in the outlet. So thank you very much. And in case you have any questions or remarks, I'm really open and will try to answer them.
Muchas gracias, Dr. Marius, por su excelente.
Thank you, Dr. Marius, for your excellent presentation, for all your experience shared. I would like to invite you once again to write down your questions either in the chat or in the question and answers section. Let us continue with the last presentation before we go to the question and answer panel. This will be Dr. Maria Irian Percedo from Sensa, Cuba. She will refer to Cuba's experience eradicating African swine fever back in 1971 and 1980. Let me talk briefly about Dr. Maria Irian Percedo. She's a doctor in veterinary sciences, head researcher at the Animal Health Directorate of the National Center for Agricultural Safety, SENSA, a collaborating center for the OIE to reduce the risk of disasters in animal health. She has participating in disease control and prevention, both endemic as well as emergent, as ASF, which affected Cuba in 1980, the rabbit hemorrhagic disease, and the reemergence of classical African swine fever, classical swine fever since 1993. She is the director of the Disaster Center for the Reduction of Animal and Plant Disasters. She leads the national network Una Salud, One Health. This is a national center for risk analysis and disaster reduction of the Ministry of Science, Technology, and Environment. She participates in the CaribVET epidemiology and swine diseases working group. The floor is yours. No, we cannot hear you yet. Please check your audio, please. Hello, good afternoon, good evening. Now can you hear me? Oh, yes, now we can. Very well, thank you. Good afternoon, good evening, everyone. For me, it is a pleasure to be able to share with you the experiences of our country in facing this disease, which on two occasions, as was indicated in 1971 and 1980, we were able to eradicate. And these experiences could be very useful in the preparations of our different countries to face this threat. As a background, pork is an essential component in the traditional diet of the Cuban population, and there is a tradition of raising pigs in backyards for local family consumption, and therefore raising pigs in backyards is a risk factor that we have always had, and that which continues to date regarding pork safety. After the triumph of the revolution, there was a great interest in increasing pork production, focusing on industrial production, and we developed the genetic pyramid to support this development with specialized races and not the Creole races that prevailed in the country at the time. In that period, we also had the fortune of strengthening the official veterinary service through the creation of the Veterinary Medicine Institute in 1963, which is today called the National Animal Health Center, SENASA. At the time, research went underway in animal health, and there was greater diagnostic capability developed for emerging diseases. This was a national policy to develop a national center back in 1969, and later included the plant side, and now we call it the Agricultural Health National Center. Basically, it aimed at building capacity and training the staff to better understand the diagnosis of any emergency related to the introduction of exotic diseases. Under these conditions, well, our country faced in 1971 the first outbreak of African swine fever. And both at that time in 1971 and in 1980, our institution, the National Agricultural Health Safety, was the one that was in charge of the diagnosis of the disease. On the map here, we show that in 1971, the outbreak affected the older provinces of Havana. Havana at the time was divided in two provinces, and it was contained in that territory initially. It was contained, the emergency was contained as well as the outbreak. And then in 1980, the disease affected the eastern portion of the country, all the province of Guantanamo, and some municipalities of the provinces of the bordering provinces of Santiago de Cuba and Holguín. To diagnose African swine fever, as I said, as SENSA worked on this on both occasions, but the agricultural center was originally located in the capital city of the country. But then by 1980, when at the time of the outbreak in the eastern portion, it was decided that in order to avoid transferring samples all the way from the eastern tip of the island to the western tip of the country where SENSA was located, and which was no issue in 1971. In 1980, however, they decided to transfer all the equipment and the specialists of SENSA to the provincial veterinary laboratory, and it worked specifically on the diagnosis and surveillance of African swine fever in the eastern portion of the country. Back then, on none of the two occasions, there was no PCR diagnosis or testing, so the diagnosis was done through direct immunofluorescence, confirming through bone marrow leukocyte testing, and biological testing was done in immunized pigs against classical swine fever. And throughout all this time, the classical swine fever has been present in the country and has had its ups and downs as to incidents of outbreaks, and has always been under national control and supervision. So this was the procedure that allowed us to determine the presence and confirm the presence of this disease. Basically, looking at the clinical signs in the anatomopathological findings and epidemiological behavior, these were all consistent with African swine fever. A general summary of both outbreaks. Here we can see, first of all, the region affected on the first occasion on the western end, and on the east side, we will see a difference between one and another in a moment. The outbreak areas in the provinces of the Habana were a total of 33 sites, and on the eastern area, there were 83 epidemiological units later. Basically, the pigs in the 1971 outbreak, the number of pigs was much higher than the number of those in the second event in 1980. And this is basically due to the fact that in the western part of the country, basically in the Habana provinces, precisely that is where the specialized swine industry in the country was located, and all genetic centers that needed to produce replacements of the breeders in the rest of the industrial swine facilities in the rest of the countries, provinces of the country. So the number of pigs in the affected areas during the first event was significantly higher than the number in the second event. Well, the number of deaths, 12,173 pigs in establishments represented 37.4 mortality. And in Guantanamo, I must say that there was a swine population before the epizodia of 61,615 pigs, which, aside from the number mentioned at the beginning of the event, we must add to that the number of pigs that were consumed prior to declaring the presence of the disease, and the total mass is much higher than 62,000, almost 63,000 pigs. Incinerated in 1971 was 20,351 pigs, and much higher in 1980, 123,250, and slaughtered. Well, you can see many more in 1971, and I explained why, because there was greater pork density in the units as compared to those of 1980. The procedure for final disposal of carcasses was through burial, not incineration, but instead burial, and we will talk about that in a moment. A crucial aspect in our efforts to eradicate the disease on both occasions was no doubt the technical administrative structure the country has established to face a sanitary emergency like this with animals. because of the legal basis in the country, this is considered a situation of disaster. So when a disaster is considered when the ability to respond to a given phenomenon exceeds the possibilities of the affected territory to respond. And this is precisely the sanitary emergency related to serious animal diseases. And that leads to declaring disaster. This calls for the participation of the highest structures in the country, way over and above the affected territories, to successfully undertake all the actions to develop. It is worth mentioning that this structure also has a premise, which is compliance with the single chain of command at all levels for all sectors involved. And these command posts that were formed throughout the country and the provinces and even the different municipalities, not only was there an interaction of the official veterinary service, but also the other actors that have to do with economic and legal decisions and police support, and even the army to carry out the different activities and controlling access, for example. So in all these command centers headed by the maximum government level, it brings together all those sectors that need to take part and provide support to address the emergency. And in this command post, throughout the technical administrative structure, the National Emergency Commission also takes part, and it has the technical responsibility of heading all actions in the affected areas as well as in those threatened, and they must establish technical measures for other parts of the country. The National Emergency Commission also has five groups under it. One group in itself is responsible for all technical activities. Another group is responsible for gathering all information required for decision-making purposes. That is all the information, sanitary as well as statistical information, and controlling the resources being used. Another commission regarding for sanitation based on the control and eradication plan. Another commission that has to do with economic matters to ensure adequate funding for all activities undertaken. And another group which is veterinary assurance, and this has to do with all the material resources to support the technical activities. The most important technical group has subgroups of diagnosis, surveillance, epidemiological surveillance, sanitary control, and external quarantine. These are the working groups responsible for activities that have to do with these elements, that is, diagnosis itself, surveillance, control, sanitary control, and external quarantine.
In this timeline or chronology that I try to summarize, well, we can see how in the Havana province there was a suspicion and it was confirmed that the disease was present on May 6, 1971 in a fattening farm of 11,425 pigs. And that was the place from which the disease spread to other 3 farms for a total of over 9,000 pigs affected. And in the Havana province, that's the capital of the country, so it is a territory that is quite complex in terms of its dynamics from the economic standpoint, from the productive standpoint, like any other capital cities. And so in this other scenario, the disease was then diagnosed and confirmed on May 6th. It was seen that it was AFS on June 17th. And then ASF, I'm sorry. And then all the coordination was made in order to eradicate the disease. This decision was taken at the highest governmental level in the country. We could not coexist with this disease if we wanted to develop the pig industry to an adequate level. Therefore, the decision to eradicate the disease was adopted immediately. And then this was the decision of depopulating and calling all the affected pigs or pig population in this province. And also in the affected provinces, and a border was established in the neighboring provinces. That would be Matanzas and Pinar del Ríos. Once this population was called and eliminated, and all the disinfection and control measures were adopted, a quarantine was developed. And there was a recovery. We placed sentinel pigs, that is, areas that were not affected by the disease, and those were kept in the affected farms, and they were being rotated during periods of 45 to 50 days, or 45 to 50 day periods, so that they could be slaughtered and sampled to confirm the absence of ASF. These animals who were placed as sentinel pigs in the places where the disease had been detected were monitored daily by appointed officials who were supervising the sentinel process. And once the animals were slaughtered, the sentinel pigs were slaughtered, and there was no circulating residual virus in the whereabouts of the focal areas, then there was a gradual restocking of pigs or repopulation of pigs. And for over 10 years, it was considerably limited, particularly whatever had to do with backyard production, particularly because of the importance that this production had in the Havana provinces and the need to repopulate this genetic pool and develop the plan that existed to increase this national pig production. So, some of the main facts for the eradication campaign of ASF in 1971, that, as I mentioned before, the pig farms dedicated to the industry in the country, we had the genetic pig farms mainly concentrated in the western provinces. Therefore, the impact of African swine fever in the country back then was very significant and very negative in the development of pig production, because the genetic nuclei had to be replaced. And the intentional introduction of the virus was disclosed in a newspaper of the USA, and this was said by somebody. And again, this was something that was disclosed in a newspaper, and this had a very interesting impact. And also in 1971, ASF was limited to Africa and to the African continent. So once once it was seen that the virus had been eliminated, then the backyard pig production was banned in the affected provinces until after 1984, and then it was allowed gradually. And a lesson learned with the problem that we had in the genetic pig farms is that we could not have this population, which is strategically so important, located in a single place, because it is very important for national soy production. Therefore, genetic farms were created in all provinces to guarantee territorial self-replacement in the other territories. Then the biosecurity systems were in intensive swine production were strengthened. ASF then was also given an important place in undergraduate and postgraduate programs of veterinary doctors, and we needed to be ready. The idea was that we needed to be ready in case another emergency took place. And the trauma, we can call it that way, that this experience caused increased the risk perception that we had to have of the ASF threat for all swine production sectors in the country. Again, this is the chronology of the second outbreak. It was similar to the previous one. Once the affectation by ASF in the DR and in Haiti in July 1978, the country decreed a sanitary alert because we wanted to be ready for the threat that this disease posed. And towards the end of January of that same year, 1978, we had the first suspicion of the disease. And it was confirmed in the most western province of the country, in Guantanamo. And then it went to Santiago de Cuba and Holguín in the month of February. And the last outbreak took place in Holguín on March 2nd. The last outbreak was confirmed 2 months after it had been confirmed the first time. And so, as of that date, no new outbreaks presented themselves, and this was because of the speedy manner in which the government acted once the disease was diagnosed in the territories. With this sanitary emergency established in the territories, the sanitary alert was placed in territories that were not affected as well, so that it wouldn't spread to the center and the other side of the countries. So it didn't happen. And then the control measures were developed up to May 30th, 1980. And after that, a quarantine was established until we had the recovery from the disease. And between August to October, again, following the same strategy that was developed in the previous occasion, sentinel pigs were placed in 112 sites for 45 to 50 days. And then there was a daily control of these animals. Then they were slaughtered and nosed by to 20% of the sentinel pigs. And so we were able to see that the disease had been controlled and that movement was not taking place, and we were able to eradicate the disease. So I just want to highlight the number of places, which is greater than the number of focal points where the disease was found, because the sentinel pigs were also placed in areas where the callings and the burials were made. So not only the farms, the intensive production farms were sentinels, but also the places where animals or the pigs were in the backyard type production, and where there was a report of pig dying. So again, this entire process allowed us to make sure that we had been able to eradicate the disease for the second time. In the episode of 1980, we need to highlight that Guantanamo, which is located in the most eastern part of the country, had around 90,000 pigs, but mainly in backyard farms. They only had a semi-technified farm with 8,000 animals. And in Baragua, the municipality that is located towards further the east in the country, that's where the disease was first confirmed. This is in Baragua. And compared to 1980, the territory that was affected this time has an important mountainous topography, which is quite complicated. And this may actually be or was a challenge for the development of surveillance activities, and also the surveillance that was carried out after animals were culled to be able to locate sentinel pigs and make sure that the viral circulation was eliminated. So this was an important challenge that had to be overcome and taken into consideration. And of course, we cannot use this as an excuse for not having success or for not succeeding. The probable date of introduction of the ASF was probably towards the end of 1979. And this diagnosis of the disease was made in January, may I remind you. But as it happens worldwide, the New Year's Eve celebrations may have contributed to this dissemination because of all the family and gatherings and meetings that take place. So it means that the consumption of pig is important during these dates. So we believe that also helped in the dissemination of the disease in the Guantanamo province. These New Year's Eve celebrations probably led to the mobilization of many pigs and pig products for their consumption. And then the disease spread from Guantanamo to the two border provinces through the trading pigs and byproducts. In Santiago de Cuba, the disease limited itself to 4 municipalities. Holguín, 3 municipalities. And this is important to say because once the eradication program was initiated, we understood that the disease might have spread to the entire Guantanamo province. And so the entire Guantanamo province was depopulated from pigs, like the 4 municipalities of Santiago de Cuba and the 3 of Holguín in focal and perifocal areas. Feral pigs, which of course exist in these territories, particularly in the mountain areas, were hunted and slaughtered with hunter brigade volunteers. And because this was a very complicated activity with volunteer hunter brigades, and of course, these feral pigs were caught because we didn't want them to be a residual reservoir of the disease in the country. Right now, we don't have wild boars, but feral pigs and domestic pigs that live freely, and those are the ones that could actually complicate at some point the task of eradicating the disease. So, having adopted all those measures, dissemination was quickly interrupted, and it was limited to the areas that I already mentioned, with very strict quarantine measures and the supervision and control established at inspection stations that were located in roads, train stations, ports, and airports. And these inspection stations had public officials 24/7, accompanied by technical staff that would supervise all vehicles, disinfect the places where the cars traveled, and people had to get out of the cars to walk some sidewalks that had disinfectant, so that at least a greater control was carried out against the dissemination of the disease beyond the affected areas. And in these inspection stations, supervision and sanitary controls were established also along the roads to try to see those who were violating the ban of moving pig byproducts. And so those things were seized and burned by the road, by the station, to prevent the movement of said products and prevent the risk of spreading the disease further on. And we also need to highlight that in the non-affected provinces, brigades or inspection commissions were created, and they were controlled or handled nationally, so that we could make sure that the biosecurity measures were being complied with in the farms, and then also as well as in the slaughterhouses and producing and processing facilities. So we needed to make sure that the diagnosis that was happening in the rest of the country was being supervised by national commissions made up or composed by experts who were in charge of making sure that all the established measures in the control and prevention program of ASF were being taken care of and complied with. The sanitation of outbreaks, we had a depopulation and culling of the pigs, and this was with compensation. The losses were compensated to the farmers. Then the burial and cremation of all slaughtered pigs took place, the strict quarantine of farms, just to the point that we just needed to make sure the absence of viral circulation through the sentinel pigs, a initial sanitation that included the mechanical cleaning, deep mechanical cleaning, the collection of residues, food, and objects in contact with the pigs. And the backyard sites are quite common in our country, and particularly in that area. So these rustic sites, they're made of wood or a palm tree, were disinfected. Where no disinfection was feasible, they were eliminated. And so these areas were disinfected in that way. Then our pig farms are in the other places are not made of wood, they are all made of concrete. So the areas that were destroyed were pretty much small pig corrals of 2 or 3 pigs. that might be produced in a rustic manner in the backyard of houses. But the commercial production places are made of such a material that allows for disinfection. Then we also have pest control. And this has to be done because once the rodents are clean and the available food is not available to rodents anymore, they may actually become vectors of the virus because they leave their regular areas of dwelling to different areas. So if we don't do this from the very beginning so that this rodents, even before the food is eliminated, do not move to other neighboring areas, then we are facilitating for them, we are stopping them from becoming real vectors of the disease as they look for more food elsewhere. If animals were in touch with the soil, then plowing and mixing the soil with lime was something done, and the weeds were eliminated in the surrounding areas of the pig farm. And after this first cleaning system or processes, 3 disinfections were carried out at 10 to 15-day intervals up to, as I said before, 3 disinfections were held. Then for 45, 70 days, the places were repopulated with sentinel pigs, and then we had the daily clinical thermometry, and pigs were slaughtered and sampled just to confirm the virus was not there anymore. These sentinel pigs were located within cages that were moved to different places or different big establishments so that these pigs may actually become in contact with all the areas. And they were observed on a daily basis to make sure there were no signs of the disease and a diagnosis could be done immediately. Now, some general data for the ASF in Cuba in 1980. We need to highlight that the predominant clinical form was acute and subacute, with the morbidity and mortality, which was interesting, almost close to 100% of the animals. In the places where the disease was diagnosed, out of all the cases investigated, at 9,587 cases, 89 were positive. And depending on the resistance of ASF under pH, this allows us, as we said in a previous presentation, that in the places where the study confirmed that there was a mortality in these backyard farms, then the pigs were taken to peri-urban sites to leave them there. In said places where the carcasses were placed, we went and checked if those carcasses had a ASF. And even though these carcasses were already petrified, the bone marrow allowed us to see that the ASF was present because of this pH resistance of the virus. So temporary slaughterhouses, 57 were placed. Guantanamo only had 1 industrial slaughterhouse, which was not enough to depopulate the province. So in the areas close to the outbreaks where the movement of animals could be guaranteed within the province, certain conditions were created to be able to cull the animals, and in that same neighboring area to bury them, bury the carcasses that were covered with lime to prevent scavengers to dig them out, or also animal or dogs, for example, to dig them out and limit access to said carcasses. 216 feral pigs were captured with the volunteer hunter brigades, and also it was established that the vaccination against classical swine fever was needed, which is an endemic disease in the country. We also activated the Risipels vaccination. We established 229 stations for sanitary control and inspection. And these statistics were kept. And so more than 6,000 square meters were disinfected. And we have the number of sentinel pigs that were used here, and they were all negative. Economic evaluation of ASF in Cuba in 1980, based on the pigs disposed of and incinerated and buried and that were not used, was close to 1 million pesos. The fried pork meat that was used from healthy pigs, and since all the pigs in the province were being slaughtered, as these pigs were said to be disease-free, so the meat was cooked in some rustic kitchens that were established. And so this was some meat that was consumed as fried pork, and the remainings were then buried. But the meat, at least that of the healthy pigs, was eaten, fried. And so this meat could not leave the affected areas, regardless of the fact that they had undergone this cooking technique or process. Here we have the consumption or the idea of the concept in Cuban pesos of dead and slaughtered pigs, compensation to producers, operation costs, export losses, and the total in Cuban pesos and in dollars, Canadian dollars, and other currencies. So even though other production sectors that were not directly related to pig production were affected also in their exports. So, and I would like to highlight oranges and grapefruits that we used to export to Europe. And since this is an agricultural product, it was understood that they may have a certain risk for the spreading of the disease beyond our borders. So even though they were meant to be exported, then they were used only for national consumption. In national pesos, the cost reached 10 million pesos. Other international houses have calculated that these two outbreaks of ASF, based on the current prices of those days, might actually raise around $50 to $50 million approximately. And this not taking into consideration the delay in the development of pig production, which was only getting started in our country when we were first affected by the disease. The piglets that might not have, or whose meat might not have a commercial value, were also compensated. Then the mobilized personnel was over 42,000 people, 42,312 people, with people dedicated to the slaughtering, sanitation, surveillance, control for more than 2 million hours, vehicles, 936 vehicles, not only of the veterinary services, and that's why this has to be an intersectorial response. That's why it has to be developed with a new vectors. And then hours in vehicles, 936 hours, 130,468 hours. In fuel, you can see a considerable number of gallons were used at, and that allow us to see that total cost was not higher because of the central government's quick and timely decision to eradicate ASF. Just like in 1971, back in the 80s, in 1980, we needed to establish the eradication of the disease. And we would also like to highlight that people in general supported this campaign, as well as the social organizations in the urban areas and rural areas, the producers associations, they all were decisive for the success of the eradication campaign.
Another aspect worth highlighting is that, as I had already mentioned, in 1980, fewer were slaughtered than in 1971 because of the significant population that was located in the affected territories back then. The affected area was greater in 1980 than in 1971, but in 1971, the affected area and the eastern and the western portion of the country had the greatest population density. The mountainous characteristics and the backyard raising made it difficult to control the outbreak in 1971, in 1980 as compared to 1971. Something that we believe was an important lesson learned was that as of 1980, a national epidemiological surveillance system was developed based on the syndromic surveillance principle, because until today, we have mandatory notification of suspicion of the disease, pork diseases that match hemorrhagic lesions and that could lead us to believe we are experiencing a different disease and not the African swine fever. So in order to ensure at least think that we are taking advantage of the eventual arrival of African swine fever, we decided that all diseases that have hemorrhagic lesions call for a differential diagnosis. And as I mentioned already on several occasions, classical swine fever is endemic and is subject to vaccination, mandatory vaccination throughout the country. So having this surveillance system by block that mandates notification when suspecting such diseases, I believe, is a very valid experience, a lesson learned. More lessons learned allow me to highlight that we must be prepared. We only have 3 more minutes to end, if you do not mind. Okay, quickly, I'm about to finish. Facing situations of emergency, we need to have prevention programs, communication, dissemination. We need to ensure specific and differential diagnosis, technical administrative structures to guide these processes and emergency operations. We need to have emergency operations in line with all sectors, and we need to strengthen control measures in the external quarantine zones to avoid the introduction of a disease. This is pre-emergency as part of prevention. But to face a sanitary emergency, we have to quickly outline the episodic areas. The other specialists spoke about this before me. We cannot outline these or limit them by default because of the many other elements to consider. We need to control the carcasses, dispose of carcasses and wastes in affected areas, utilize healthy animals. The sources of outbreak need to be examined and controlled in greater detail. We need to supervise non-affected areas. We use students from veterinary services or veterinary studies. The students in later years have been trained to participate and strengthening the control measures in the external quarantine areas to ensure this does not go beyond borders and become a threat for the rest of the region and of the world, in fact. So with this, I have shared my experiences. I thank you very much for the opportunity given to me. Thank you. Thank you, Dr. Maria. Very interesting to listen to Cuba's experience. And we could spend a whole webinar hearing about all the details, all the aspects that you experienced. For time reasons, we will only have perhaps some 15 minutes for questions and answers. Some of the questions have already been posed through the chat, and Dr. Nieto and Dr. Gallardo have responded to a good part of those questions, so we will focus instead on the other questions that have not yet been responded. So let us begin with a question. Well, before all of this, allow me to mention that these webinars, all of them are available on social media. You can get these in all 4 languages, English, Spanish, French, and Portuguese on the social media, both on Facebook as well as YouTube, under IICA. And we have been asked also about the list of participants. This is limited because of the personal data protection law. We would be unable to share the list of participants. Now, back to the questions. Miguel Ángel Rodriguez Gomez is asking, recovered animals, can they transmit the disease? The question basically is for Daniel, and if you want to add, if other experts want to add anything else, go ahead. Go ahead. Carmina seems to want to respond. I think I seem to understand.
Sí, bueno, yo, si no, bueno, si quieres decir tú algo, Daniel, también, quiero decir.
No, you can go ahead and answer, but I can do it. No matter.
Lo que quería decir sobre esto es que es verdad que hay mucha controversia relacionada con el papel de los animales que sobreviven a la infección como portadores de la enfermedad. The
survivors of this disease and their transmission. Animals that do survive are capable of transmitting the virus at least 3 or 4 months after having been infected, at least for African swine fever. But what we have seen is that once the animals overcome the viremia phase, they have viremia for about 2.5 months. The probability of their being able to not only carry the virus, but they do have it, but transmit the virus, I guess is the question. One thing is to carry the virus, and they could have it in different tissue, and something else is the possibility of transmitting it, but after 2.5, 3 months, the probability decreases. Something else that has been described is that these animals would be capable of transmitting the virus because they do have it in some of their organs.
serían capaces de transmitir el virus cuando estos animales estén en un estado de inmunosupresión, en fase de activaría el virus, y también cuando ocurren infecciones secundarias, donde el virus se queda primariamente en las tonsilas o en los sitios de replicación primarios. Ahí sí que se ha visto que en estas infecciones secundarias de las vías aéreas a los ganglios linfáticos. En general sí que es una pregunta que todavía es verdad que después de tanto tiempo no tiene una respuesta totalmente clara, porque no se puede establecer exactamente ni el porcentaje de animales que son capaces de transmitirlo, no de portarlo, sino de transmitirlo una vez que han sobrevivido a la infección. Pero está claro que existe un porcentaje de animales que sí son capaces de transmitir el virus, dependiendo de las condiciones en las que estén y dependiendo de si existen infecciones o no.
And whether they have secondary infections or not. Thank you, Dr. Gallardo, for your thorough response. Feel free, please. There are questions that are not directed at a given expert, so if anyone can feel free. Like the next one that says, transmission is only through direct contact, or is there possibility through semen or embryos? Well, I'll try. Through semen, yes. Yes, transmission is possible. And through embryos also, yes. Well, not for embryos, because I'm not quite sure, because this is a short time window. Okay, thank you, Daniel. It is important to consider all questions so that there are no voids or unanswered questions. Let's see. Over here, Dr. Kiko Kamata is asking whether samples must be sent in liquid nitrogen after a given number of hours of obtaining the samples. That is, each shipper needs to have the dry containers, and these dry containers will they be sent back to the original sender? No, it is in fact dry ice. Nitrogen, liquid nitrogen would be in the case of a cell culture, and they have a long wait time, but normally they must be, the samples must be frozen, at least refrigerated, but depending on the system, the transportation system, well, they may be frozen. Okay, in fact, there's another comment down here added by Dr. Kiko. To send category A materials, must the person sending it, the shipper must have at least 2 years of experience. Anything else to add to this question? Otherwise?
Bueno, yo sí que quería agregar una cosa. Que
I would like to add something else to consider with African swine fever is that unfortunately for the current situation, but fortunately for diagnosis, the African swine fever virus is very stable. And since it is a DNA virus, it is much easier. So if it is under refrigeration appropriately, fine. If that is not possible because of the conditions in the country or at a given point in time, in this case, the virus is easy to detect through PCR. So in this sense, I have a lot of experience. I have been working in Africa with African swine fever, gathering a lot of information, and we have seen that this has been the case. What is important is to have a good diagnosis. Dr. Gallardo, thank you. Next question by Fernando Perez. Which diagnostic techniques would be most convenient for sampling and have ASF-free areas or zones?
Yo no entiendo muy bien la pregunta.
I did not understand the question, really.
¿Para declarar un país libre o para
to declare a country free? To declare a country free, yes.
Bueno, yo no sé si Daniel, eso, yo no sé si.
Well, Daniel, it depends on many factors. If they want to take samples to see if we're talking about an area or an entire country, but with techniques,
mediante técnicas,
no,
si se refiere a técnicas de diagnóstico,
a diagnostic technique.
Eso, si se refiere a técnicas de diagnóstico para que se declare
if it is a diagnostic technique,
tiene que
to declare it free,
ningún caso mediante PCR
no case must have been confirmed via PCR for at least 3 years.
No puede
The
existir
PCR
ningún
technique
caso positivo en técnica de PCR por al menos
there must
3 años.
be no cases at least for 3 years.
Según la OIE.
According to the OII, excuse me. Compartmentalization is also very important. Remember that. In the case of compartments or zones, this was published not long ago. It depends a lot on the circumstances in the country.
Dirigida la pregunta. Exacto.
Yes, thank you to both. The answer was pretty much looking for that, or the question was looking for that kind of answer. Now we have a question by Dr. McAllister Fur. This question is for Daniel. What has been the role given to terrestrial transportation and trucks in the spreading of ASF in Europe? The role of trucks and terrestrial transportation is a problem that we have with ASF in Europe and in the world as a whole is that, sadly enough, when we do the investigation of the outbreak, we don't find how the disease got into some establishment, particularly because we know there's been some sort of irregularity. So most outbreaks generally do not give us the why, but transportation by trucks, that is something that it may be important when we talk about long distance. But when you go to a farm, basically the problem is when pigs are fed with trash or leftovers. If this is a truck that is transporting live pigs, well, maybe when we disinfect the truck, if it's not well disinfected, that may be complicated. But what has been said is that they may play an important role when stopping in service centers where there are food leftovers. And so those things may end up in places to areas where the wild boars have access to set food. So again, obviously, when there's some sort of transportation or when there's been wild boars involved in this type of problem, is because there was some sort of movement of transportation involved as well. It's hard to give exact role because generally it's not known, but yes, there is a possibility, of course. Thank you very much, Daniel, for your answer. We have another question by Jaime Barrero, and this question is for Dr. Marius. In Lithuania, affected farmers were compensated?
Yes, for sure. So that's actually the main important thing, because otherwise, so the farmers can try to not inform the competent authority about any suspicion or any presence of the disease. So the compensation is the main tool of the motivation. And of course, with the compensation, we're trying to somehow to compensate their losses of the animals, their products, cleaning and disinfection.
Muchas gracias, doctor. Hay otra pregunta.
Thank you very much, doctor. There's another question for you in the chat. So based on your experience, which would be your recommendations to control the mobilization of animals, such as cattle and their products, and pork and their products that may have in areas that may also have backyard pigs?
Actually, it really depends if we are talking about the affected holding, affected backyard, where the African swine fever was confirmed, or just the backyard which is in the close vicinity. Because in the national and the EU legislation, actually the main focus is to the animal species which are susceptible to the disease. So that's mean for the porcine animals, domestic pigs or kept wild boars. As regards the regulation of the movement of the bovine animals and their products, it is very clearly recommended that non-essential movement should be prohibited, and especially from the holding where the disease is confirmed. But the risk that the disease would be transmitted by a mechanical way is very, very limited, and the competent authority, based on the risk assessment, may allow the movement even from the backyards with their cattle and, of course, their products. Everything is based on the risk assessment.
Muchas gracias, Dr. Marius. Y tenemos
Thank you very much, Dr. Marius. And we have another question for Dr. Maria Irian Percedo. Now, based on your experience, what measures would yield the best results in external controlled centers, airports, and ports to prevent the entry of the disease? Well, in ports and international airports and all international entry ports for passengers, it is important to locate signs that may also help passengers to become aware of the products that they need to avoid transporting to reduce the spreading risk via food products that may be coming from affected areas. But the veterinarian service, official veterinarian service personnel in charge of sanitation in these ports play a very important role because they have to survey the entry of passengers. They have to survey together with the custom service the legal entry of food products that the passengers may be actually carrying in their luggage, as well as the international commissariat that may actually bring boats or planes that need to comply with certain very strict measures to prevent from the disease from entering through them. So the participation of the veterinary service is very important, but also the training that this veterinary service may actually provide to the personnel in those ports, so that they in customs and immigration control can also facilitate the information and highlight the importance of not allowing these exotic diseases to come into a country's territory, be it ASF or any other disease. So the official veterinary service plays a key role in terms of external quarantines as well to prevent the entry of the disease. And there's an important role to prevent, once the country has been affected, for the country to be also a potential spreader of the disease elsewhere in the world. So these are key factors to control the dissemination of this type of diseases. And Dr. Maria, I believe somebody was asking if this also applies to mini pigs that are highly commercialized nowadays. Any susceptible species needs to be controlled for whatever diseases they may be susceptible to. Mini pigs, we haven't had that experience yet, but if they come from affected countries, we must ask for a warranty that they are not the carriers of the disease. So probably a procedure needs to be put in place to prevent those pets to become a way that the disease can enter the country. And this should also be carried out and surveyed by the competent veterinary authorities from the country of origin. Well, thank you, doctor. I don't know if anybody would like to add anything else. Well, if not, we ran a bit out of time. We're actually way ahead of, way after the time we should have finished. I would just like to thank from the bottom of my heart, all the presenters, because your presentations have been excellent. Participants should feel free to communicate what was said in this webinar in your countries to whomever who needs may need this information. If you have any other questions, please feel free to send them to us. We can distribute your questions, or we can give you an email where you can send us your questions, or you can post your questions in the chats of the social media, and we will check those later on. I would like to thank OIE, FAO, Rocío Camposana, Katya Martinez, Jose Burdaz, and Dr. Pastor Alfonso from CENSA, who also represents CaribVET, for their collaboration in the organization and the logistics of this webinar. Dr. Beltran, Dr. Marius, Dr. Maria Percedo, Dr. Nieto, and Dr. Gallardo for all the experiences you shared with us. I told you I had some important news to share with you, and that is the next webinars we will be holding. Every month, we are trying to hold a different webinar for you, so the countries can become prepared to prevent the entry of ASF into your countries. And hopefully you will not get it, but if you do get it, how to react. And so for April, we will be holding a webinar on an updating in the actions on ASF in the Dominican Republic. May, we'll have a webinar on legislation and contingency plans on ASF. In June and July, we will have webinars dedicated to the topic of communication of risks, and communication of crisis. And for the second half of the year, 2022, we will have in detail all the protocols that our experts mentioned today in diagnosis, mobilization, culling. All those protocols will be covered in detail, hopefully during the second part of the year. So we will be holding webinars on all these topics, and hopefully we will be seeing Dr. Gallardo, Dr. Neto, Dr. Marius, and Dr. Daniel Beltran and Dr. Priscilla again in the future. So that was the announcement that I had for all of you. Please follow us. Please don't miss any of this webinar. Your participation in these webinars is very important for us, and the participation of the region is very important for us. So without further ado, we bid you farewell. Have a wonderful week. And see you in the next webinar. Thank you all. Thank you very much. Bye-bye.
Hasta luego, gracias.
Bye-bye, thank you.